Nigeria on Wednesday, January 15, played host to a regional meeting on Lassa Fever vaccine development. Lassa Fever is endemic in Nigeria, posing a significant public health risk across all states. As of week 52 in 2024, the country recorded 9,685 suspected cases of Lassa Fever, 1,187 confirmed cases and 191 deaths across 28 states and 138 local government areas. Last December, the Nigeria Center for Disease Control and Prevention activated the Lassa Fever Emergency Operations Center to address the current Lassa Fever outbreak during this peak season. In 2024, the Coalition for Epidemic Preparedness Innovations, CEPI, supported the first ever vaccine entering phase 2 trials in Nigeria and 2 other West African countries. The largest ever study tracking Lassa's burden expanded further. New coalitions are also being formed to align with the development and future delivery of a Lassa vaccine. Joining us on the show this morning to discuss the deadly and increasing threat of Lassa across West Africa, how Nigeria is helping to test promising Lassa vaccines, and how close we are to licensure of a much-needed Lassa vaccine, is Dr. Richard Hatchett, CEO of Coalition for Epidemic Preparedness Innovations, CPI. Good morning, Dr. Hatchett, and welcome to the morning show.
Good morning. It's really a pleasure to be here and a pleasure to be back in Nigeria.
Thank you very much. Dr. Hatchett, yesterday you had the Lassa Coalition governing entity inaugural meeting in Lagos. And just to give us a snapshot of what happened in terms of the outcome of that meeting, I know that your organization, alongside working with Nigeria, the Nigerian government and other organizations like yours, are working really hard to end, or at least to find a way to contain the Lassa endemic in Nigeria. Can you please share with us some of the outcomes of that meeting and what the next steps are following that congregation?
Sure. Well, actually, the meeting will take place this morning, so we're just about to head into it. But let me talk a little bit about what the meeting will be. The Honorable Coordinating Minister Pate and the Director General IC of the West African Health Organization have assembled basically senior leaders from across the 5 countries that CEPI has been working in over the last several years on Lassa fever. That's Nigeria, of course, but also Sierra Leone, Liberia, Guinea, and Benin, to come together to begin thinking about how the countries would receive and use a potential vaccine. CEPI's been supporting vaccines for Lassa fever almost since the organization was created. We've been working in Nigeria since 2019, and the vaccines now are maturing. And you mentioned one of them is already being tested in phase 2 clinical trials here in the region. And what will be really important is to help the communities that we're trying to serve understand the vaccine, understand the clinical trials, make sure that the countries are prepared to receive and introduce the vaccines in their countries. And then we need to think about issues like procurement and sustainability and manufacturing. All of these issues are going to be discussed today.
Fantastic. Now, I mean, let's delve deeper into Lassa fever itself. This terrible disease that comes around, seasonally and, highly contagious. And I think there's a lot of misinformation as well, lack of understanding as to what the real source of this disease is. Because, in some instances you're told rats, in some instances, So can you just give us a little bit more of sort of an outlook of Lassa fever itself?
Sure, and let me just mention for historical purposes, Lassa is a disease that was first identified here in Nigeria in 1969. So that's 55 years ago. And in fact, my first visit to Nigeria in 2019, shortly after coming to CEPI, was to come to the first international conference about Lassa fever that had ever been organized by Nigeria's CDC, Dr. Chikwe at the time. It's remarkable that a disease that had been around for 50 years that is as deadly as Lassa can be had never had a conference before 2019. And of course, we had some treatments, but no vaccines. And so we've been working to develop the vaccines that would enable the countries to protect their populations. Lassa as a disease is caused by a virus, the Lassa fever virus. which circulates in wild populations of rats. And it is basically, in most cases, we think it's exposure to the droppings or to the urine of these rats that causes the transmission of disease into human populations. There is human-to-human transmission, and often we will see outbreaks in hospital settings where there can be transmission between individuals, patients, and doctors or caregivers. And of course, that's terribly frightening. Historically, the disease obviously was first identified in Nigeria. It was typically concentrated in the south of Nigeria in Ondo, Edo, and Ebonyi states. But what has happened over the last decade or more is the disease has actually spread. So last year, Lassa Fever disease was documented in 28 Nigerian states. It is stretches, the Lassa belt stretches from Nigeria over to the coast in Sierra Leone, Liberia, and is increasingly identified in the countries in between as well.
All right, thank you, Dr. Hatchett. Let's talk about the vaccine. It's interesting that you talk about the fact that Lassa fever has been in Nigeria for over 50 years, and it's usually exacerbated during the dry seasons where we see more cases emerge. However, it's great news to hear that you're in your second stage of testing for the vaccine. But usually what a number of people would ask in a country like Nigeria and other countries in Africa would be the cost of these vaccines. Are there any conversations around whether it would be made free to citizens or how much the cost of obtaining the vaccine would be at the time when it is finally completed?
Well, beginning to talk with the governments that are involved and responsible for the populations that are affected by this disease, that's why we're starting the conversations now. Issues like cost and manufacturing have not been fully determined yet. We are committed as an organization. I think our partners in the different ministries here in West Africa are committed to seeing that this vaccine can ultimately be manufactured here in Africa. And it depends on there are a number of vaccines under development. It's not just a single vaccine. CEPI right now is supporting a portfolio of 3 different vaccines. The one that's in phase 2 clinical trials is the most advanced and very promising. But it depends on which vaccine shows success and how it's manufactured that will determine issues like cost. But we would view this as a public health vaccine. This would be principally a vaccine we would imagine that would be procured by governments and then administered to their populations with some of the issues around costing effectively still to be determined. But I think we're all committed to recognizing that we need to get the vaccine to the populations who are suffering from the disease and not have cost be a barrier.
Absolutely. Now, beyond cost, we know that there's often a negative perception of vaccines in many communities across Nigeria. What are some of the initiatives to engage with these communities, to educate them? And also, do you think people will be receptive to a vaccine at all?
Well, so in Nigeria, as I mentioned, the disease has now been seen in 28 states, but there are still hotspots of disease in the 3 states that I mentioned, also more recently in Bauchi. And so I think the populations in those regions are perhaps most aware of the disease of any of the populations in Nigeria. It's really, really important to engage communities in the development, in the ownership of these vaccines. One of the things that CEPI has been doing for several years, we've been working very closely with Nigeria CDC as a partner to better understand the epidemiology of Lassa fever. And by that, I mean the incidence of disease, which parts of the population are being impacted, how the disease actually evolves when people are diagnosed. And we've been doing that in the areas where we think we're going to be testing the vaccine, which will be these hotspot areas that I described. And so there's been ongoing engagement with the communities led by Nigeria CDC through this epidemiology study over several years. And so the communities are aware that a vaccine is coming. You're absolutely right that concerns about vaccines are a very prominent part of public discourse today. And you have to maintain the trust of communities. You have to build that trust. You have to engage them in the process of the development of the vaccine. So they're receptive to it and excited about the fact that it hopefully is coming in the next several years.
It's really good to hear that people are excited about it. You've talked about your partnership with the Nigerian government through the Federal Ministry of Health under the leadership of Dr. Pate. However, I'd like you to share with us some of the limitations you envisage and how you hope that the Nigerian government can work with you, partner with you to ensure that we are able to contain this threat of Lassa fever and hopefully be able to say, like we did with polio, that we've seen the end of it.
Well, let me first commend the Nigerian government. The surveillance for this disease here in Nigeria is the best in the world. We are learning a tremendous amount about the disease because of the increased surveillance and increased documentation of illness that is being led through Nigeria CDC and the state governments. One of the biggest challenges that I would anticipate for any vaccine for a disease like Lassa, I mean, Lassa is kind of a classic example of what we would call a neglected disease. It has been episodic until the surveillance has increased. We haven't really understood how common the disease was. There have been very few commercial drivers for big multinational pharmaceutical companies to develop a vaccine. That's why CEPI got involved. We were created effectively to work on vaccines where there wasn't a lot of research activity, typically because there weren't large, easily definable markets for the vaccines. And because those markets are uncertain, once we have a vaccine, once we have a technical success and we demonstrate that we have a vaccine that works, that vaccine has to be manufactured and it has to be sustained for the long term. And I think that's going to take public-private partnerships. It's going to take local leadership, government leadership to ensure that the vaccines are procured, that they're used in a rational way, that they're introduced in an appropriate way for the populations that need them, and that we can ensure that they continue to be manufactured over time so that those populations can continue to have access.
Right. I was reading a little bit about some of the studies that you've done across Nigeria, and I came across some information about malaria, incidents of malaria co-infections with Lassa fever as well. How much of an issue is this?
Well, co-infections with diseases, one of the reasons that's really important is that if someone has malaria and then becomes ill with Lassa fever on top of the malaria, or vice versa, you then put the person is increasingly vulnerable to the severe consequences or even potentially to death from one or the other disease. And obviously malaria is a very important disease here in Nigeria and is a backdrop against which these exposures to the rats that carry Lassa fever are occurring. And so incidents of co-infection will occur. It's not, though I should say, it's not as if the malaria and the Lassa will interact and form some new super pathogen, but it's that the impact of the two diseases on the individual who's unlucky enough to have both at the same time could result in really bad outcomes. One other bad outcome of Lassa, I should have mentioned it earlier, of those who get Lassa and survive, a very high percentage, maybe as many as a quarter, will have hearing loss. And only about half of the people who have that hearing loss after having Lassa fever will recover their hearing. And so that could be a lifelong, really devastating consequence of the disease.
Well, thank you very much, Dr. Richard Hatchett, for your time with us this morning, and all the best with your meeting later on today. Thank you.